I mean, there are so many journeys that exist. I mean, we all have a different path, and you know, and trans identity is only one, and no one is wrong for how they understand themselves.
My name is Danny. I work at the University of Michigan for a couple different programs. On this project, I'm working with the Adolescent Health Initiative to get information about what it's like for transgender young adults to navigate the healthcare system in hopes that we can work to make it better. As a transgender person myself, I care a lot about educating people on this issue and improving our healthcare services, especially because many trans youth are at high risk for depression and suicide. For this project, we met with transgender young adults in the Ann Arbor and Detroit areas to hear their experiences with healthcare. We recognize there are many other viewpoints not represented here and do not intend to speak for the entire transgender community. This video was created as a companion to trainings by the Adolescent Health Initiative for healthcare providers and staff. It's our hope that sharing these perspectives will help you better understand some of the challenges faced by transgender youth so we can work to improve the healthcare system.
I would like to be asked what pronouns to use, because for me, when somebody says he, it really upsets me and almost like breaks me down, and then it's like, oh, you know, I might as well just leave because I'm sure I can handle this on my own. You know, I came to you for help and you just, you know, ruined my entire, you know, week.
Jordon, when would that happen to you? Like, when would it feel best for that to happen? Is that like over the phone? Is that on the form?
I think on the form, because, I mean, that would be a little bit weird to be, you know, what pronouns do you use, you know, making your appointment. I feel like that would be a little bit too in your face.
Have you ever encountered problems filling out forms or like frustrations with having to like check certain boxes?
Yes. That male, female box, that, yes, because I want to mark female and legally I can't, and that irritates me. Or I might be on the phone with them and they may say, well, what is your gender? You know, and I have to tell them what my legal gender is, but that really frustrates me. It does.
Do other folks have similar experiences with that or different experiences that you would want to talk about?
They actually asked for your like preferred name, and I put it down. I was like, yeah, like they're gonna use it, and they didn't. And I was like, so what was the point of me putting it down if you're not gonna? So like, yeah, I get that there's the good intention, but like you're not gonna implement it. There's no point of putting it there.
If you could list off just 5 words or terms that you would like your healthcare providers to know or be comfortable with and like do some education on their own about, what would those words be?
Those would probably be cisgender, transgender, gender nonconforming, cissexism, transphobia.
Cool. So just learning those things would be good.
Yeah, oh my goodness, please learn them.
So cis or cisgender is someone who identifies as the sex and gender that they were assigned at birth. So that's when the doctor like sees the baby and they're like, oh, it's a boy, or oh, it's a girl. They still identify as whatever the doctor said at the time.
I'm not big on terms. I just like for people to be respectful. As far as like, if you don't know, pull me to the side and ask me. Or if you think you know and may have an idea, still pull me to the side and ask me. Don't be like, oh, well, she looks like a she is, or is she a he, or don't try to guess it. Like I said, I'm not really big on using terms. I just use female, and I may ask you, or I'd rather just use your name. You don't know what we're going through, and a lot goes on in our heads because we have to deal with the world accepting us being transgender, and health is something that is a big concern with us.
I think for me, one of the biggest problems I encounter is that whenever I go to the doctor, I end up telling the doctor more about my body than the doctor tells me, because they just don't really understand stuff or understand how things work, which I get, but also it's kind of their job to know. And I feel like, I mean, and I know that like hospitals are supposed to provide training for them and stuff like that, but they don't. And so it ends up being, you know, because trans people's bodies and what they're experiencing and what cis people go through are totally different in a lot of ways, but in a lot of ways they're not, and they don't really know where that is, and what kind of boundaries those things have. and it just gets really weird sometimes.
Can you just talk a little bit about what it feels like to sit in the lobby?
You know, after you done signed in, and especially like me, I don't have my name changed legally done just yet. My gender marker is not legally changed either. So it's kind of hard for me to have to sign in and, you know, give up all my documents and stuff like that. And whatnot, I retrieve them back and then wait patiently for the doctor or somebody to call you out. And then you're just waiting on that door to open, and you're just like, oh God, what are they gonna say? What are they gonna say? How are you gonna do this? You know, and then when they call your name out, I mean, you kind of don't want to just sit there, because then they're gonna look at you and be like, hey, they just called you. No, they didn't. No, they didn't. No, they didn't. Wrong person.
I just wish that their kindness like extended to trying to find a level of understanding with their trans patients that I just don't think exists for a lot of doctors. Because it's so amazing and frustrating to see those wonderful intentions and then just still leave really upset.
Yeah, a trans-friendly doctor's office would be people who are culturally competent, people who actually, I feel like if you don't have a desire to be affirming of different identities, then don't be a healthcare worker.
Statistically, you're going to have quite a few trans people entering into your office. So that's a lot more common than your very, very rare disease that you might spend a month studying at your medical school. So it's not just this, you know, one tiny segment. If you can learn and study about a very rare disease, that you can also learn and study how to be respectful and polite to trans people when they come in.
Now is more of a time than anything to want to get on the bandwagon of trans healthcare. You know, because it is happening, it is out there, and more folks are coming out, not necessarily at, you know, 30, 40 years old, even 20, consensual, I was to say. You know, if people are coming out younger and younger, you know, I Am Jazz is 7 years old. And when you actually take the time out to really focus on, you know, what your client or what your patient's, you know what I'm saying, needs are, and you really have that, oh, okay, I can do this, you know what I'm saying, because it's not really that hard, it's not that difficult. Or even if it is something difficult, challenge yourself. Challenge the medical system. Challenge the healthcare field. Do it. You know what I'm saying? Because what's the worst they're going to tell you? No.